Good afternoon and welcome to the PPE webinar, What's Love Got to Do with It on Intimate Partner Violence. I am April Davis, the PPE coordinator at the Office of Minority Health Resource Center. Before I introduce today's speaker, I just want to go over a few housekeeping notes. First, all lines have been muted for attendees. Secondly, we will hold Q&A at the end of the session, so please type your questions into the Q&A box for Dr. Henry. This session is being recorded, and the recording will be included in a follow-up email that will be sent to you 24 hours at the end of the broadcast. Also, there is a PDF version of today's presentation, as well as a supplemental deck on family violence prevention in your notes section on your navigation side of the panel. Excuse me. So now let me introduce today's speaker. Dr. Tamara Henry is a senior program analyst at the Office of Minority Health Resource Center and a teaching assistant professor at the Millikan Institute School of Public Health at the George Washington University. Dr. Henry is a public health professional who comes from a diverse background ranging from foreign and domestic consulting services to the state and local government programming to academia. She has spent over a decade in the state of New Jersey and in the local government at Washington, D.C., providing grantees with technical assistance as well as addressing health disparities and monitoring and evaluating health promotion programs in underserved populations. Moreover, she has over 20 years of experience in the field of public health disparities and has done extensive work in the African American communities in New York City and Washington, D.C. So now I will turn it over to Dr. Tamara Henry for today's webinar.
Good afternoon. Thank you for being, yes, thank you, April. Good afternoon, everyone. Thank you for being on this webinar. It's a really, really important topic, and I think that you will gather a lot of great information that you can take back with you to your campuses. Next slide. Next slide. Today's objectives, the learning objectives, we hope to provide you with an overview of the historical response to intimate partner violence in the United States, describe the types of intimate partner violence, identify some evidence-based programs that may be replicated on your campus, as well as provide resources for students and peers who may experience or know someone who has experienced intimate partner violence. Next slide. Today's agenda will give you first the definition of intimate partner violence, followed by the history of intimate partner violence in the United States and beyond, the types of intimate partner violence, along with the prevalence and statistics, followed by evidence-based solutions, prevention efforts, as well as intervention efforts. Next slide. So it's really important that we all have an understanding of what the definition of intimate partner violence is before we go forward into today's presentation. According to the Centers for Disease Control, the term intimate partner violence describes physical, sexual, or psychological harm by a current or former partner or spouse. This type of violence does not require sexual intimacy and can occur among heterosexual or same-sex couples. Next slide. So some of the historical responses to intimate partner violence in the United States starts as early as 1870s, where the courts in the United States stopped recognizing the common law principle that a husband had the right to physically chastise an errant wife. In 1962, in New York, domestic violence cases are transferred from the criminal courts to the family court, where only civil procedures apply. The National Organization for Women was founded to end the sexual discrimination in 1966. And a few years later, in 1972, Title IX, which we still have today, was passed, and it outlawed sexual discrimination in education. In 1972, the first emergency rape crisis line opened here in Washington, D.C. And from 1968 to 1973, the crime of rape increased 62% nationwide. By 1975, most U.S. states allowed wives to bring criminal action against a husband who inflicts injury upon her. And in 1985, Tracy Thurman of Connecticut was the first woman to win a civil suit as a battered wife. Next slide. In addition, the Cleary Act of 1986 was named after a college student named Jean Cleary, who was murdered and raped in her dorm room by a fellow student on April 5th, 1986. Her parents championed the Jean Cleary Disclosure of Campus Security Policy and Crime Statistics Act in her memory. This act is a federal law that requires colleges to report crimes that occur on campus and school safety policies. It also contains the Campus Sexual Assault Victims Bill of Rights, which requires colleges to disclose educational programming, campus disciplinary processes, and victims' rights regarding sexual violence complaints. Next slide. Other responses include the Violence Against Women Act, which was instituted in 1994, not 84, coordinated community response, also recognition and support for community service, as well as federal prosecution for domestic violence and sexual assault crimes. The Violence Against Women's Act of 2000, it broadened the scope of work to include stalking and dating violence. It created legal assistance for victims and created supervised visitation for children. It also improved the protections for immigrant victims. The Violence Against Women and Department of Justice Reauthorization Act of 2006 improved services for immigrants, outlined prevention strategies, developed culturally and linguistically specific services. Next slide. More current historical responses to intimate partner violence include the Campus Sexual Violence Elimination Act, or better known as the SAVE Act. It was proposed to the 112th Congress in 2011 and finally passed in 2013, amending the Jean Cleary Act that requires all colleges and universities to have a clear and transparent policy regarding sexual assaults, domestic violence, dating violence, as well as stalking. It mandates the bystander intervention program, mandates the protocol for disciplinary proceedings and following certain standards. It's also enforced by the U.S. Department of Education Office for Civil Rights and applies to colleges and universities that receive any federal funding, including student financial aid. Next slide. There's also a task force to protect students from sexual assault, formed in 2014, and this task force had a mandate to strengthen federal enforcement efforts and provide schools with additional tools to help prevent sexual violence on their campuses. And CDC has a number of programs, but one that is most prominent, the Strategies for Prevention in 2016, where CDC convened a panel of experts in collaboration with the Justice Department and the sex offender sentencing, monitoring, apprehending, registering, and tracking, known as the SMART Office, and the Department of Education in an effort to identify emerging and promising practices to prevent sexual violence on U.S. college and university campuses. Next slide. Title IX, which many of us are familiar with if you're in a university setting, it involves sexual harassment. It's a conduct of a sexual nature. It includes unwelcome sexual advances, requests for sexual favors, and other verbal, nonverbal, or physical contact of a sexual nature. Sexual violence is a form of sexual harassment prohibited by Title IX. Title IX protects students in connection with all school-related events. If a school knows or reasonably should know about student-on-student harassment, Title IX requires that the school take immediate action to eliminate the harassment, prevent its recurrence, and address its effects. The Office of Civil Rights recommends that all schools implement preventive education programs and make victim resources, including comprehensive victim services, available. Next slide. So why should schools handle sexual violence reports? Title IX requires schools to combat sex discrimination in education. One of the most common objections we hear to campus adjudication is, quote unquote, but isn't rape a crime? It most certainly is, and students who report to their schools can also report to the police. Colleges and universities, however, can respond to survivors' needs that go unaddressed by the criminal justice system. Colleges and universities can act quickly to protect students. Schools, unlike the criminal justice system, are in a unique position to take action quickly to ensure a safe campus, but also really address the concerns as it relates to mental health and physical safety of their students. Next slide, please. So there are several types of intimate partner violence. As time has progressed, technology has become involved, and some of the things that we ordinarily would not think of as intimate partner violence has been added to the list, as you will see shortly. So individuals commit violence against each other in many ways. Physical is one that a lot of us are familiar with in terms of pinching, grabbing, shoving, punching, kicking, restraining, hitting, or hair pulling, biting or slapping, throwing an object, or use of or threaten to use a weapon. Sexual intimate partner violence includes pressuring or forcing a partner into unwanted sexual activity in person or via social media and texting, or making it difficult or impossible for a partner to say no to sexual activity or behavior. Preventing a partner from using birth control or other forms of contraception is also considered intimate partner violence. Next slide. Technology, some forms of intimate partner violence as it relates to technology includes impersonating a partner online or publicly posting negative comments about a partner, frequently emailing, texting, messaging, or calling about the whereabouts or activity of a partner, as well as psychological threats and or intimidation, threatening to leave or hurt a partner, themselves, family, friends, or pets, controlling whom a partner is allowed to see or what they can do or not do, yelling, screaming, insulting, intimidating, embarrassing, or spreading rumors about a partner, minimizing, denying, or blaming a partner for any abuse is considered a form of intimate partner violence. Next slide. These are a few signs that you may be in an unhealthy relationship. Again, not an exhaustive list, but these are a few signs. Intensity, ideally, this person has to be around you all the time. Jealousy, manipulation to get you to do things you really don't want to do. Isolation, meaning you're cut off from your friends, family, or people who you commonly associate with. Sabotage, belittling, insulting, making you feel insecure about yourself. Guilting, volatility, deflecting responsibility, and betrayal are just a few signs that one may consider if you're experiencing any of this, or you have friends that are experiencing any of these things. You may very well be in an unhealthy relationship. Next slide. So here are some prevalence and statistics of intimate partner violence. For those of you who are in the field, you may be surprised. For those of you who work on college campuses, you may be surprised. But intimate partner violence starts as early as some of the data are suggesting middle school and up to freshman year through senior year of high school. More than 13% of high school students nationwide experience physical abuse from a dating partner in a single year. Nearly half, or 43%, of dating college women report experiencing violent and abusive dating behaviors. 1 in 3 dating college students has given a dating partner their computer, email, or social network passwords, and these students are more likely to experience digital dating abuse. And 1 in 6 college women have been sexually abused in a dating relationship. Next slide. 20 to 30% of female students have been raped or sexually assaulted, are usually by a male student who was an acquaintance, friend, or intimate partner. So contrary to popular belief, these rapes, particularly among college students, are by people that they know, and 20 to 30% happen to involve a male student that was an acquaintance, friend, or intimate partner. 1 in 3 girls in the U.S. is a victim of physical, emotional, or verbal abuse from a dating partner. And this figure far exceeds rates of other types of youth violence. So I want us to consider that 1 in 3 girls, that's about 33%, to experience this over a period of time, especially at this age, we need to consider what that is doing to the mental health of these victims. More than half of youth who have been victims of both dating violence and rape attempt suicide, compared to 12.5% of non-abused girls and 5.4% of non-abused boys. So let me say that again. More than half of youth, greater than 50% of youth who have been victims of both dating violence and rape attempt suicide, compared to 12.5% of non-abused girls and 5.4% of non-abused boys. That is an alarming statistic that we should all be concerned about. Adolescent girls reporting recent dating violence were 60% more likely to report 1 or more suicide attempts in the past year. So this is having devastating effects on the mental health of young people. Next slide, please. So here are some strategies, some interventions that one may use on college campus or in your community-based organizations with youth. The CDC Stop Violence has a system-level technical package to prevent sexual violence. So there's a strategy and approach. So the first strategy that begins with S, it's to promote social norms that protect against violence, using the bystander approach and also mobilizing men and boys as allies. We want for everyone to be on the same page in terms of what intimate partner violence is and understand enough that you can speak up on behalf of persons and normalize this discussion. There is a right and a wrong way to do things. If something's not right, you need to be a part of the solution. T, teach skills to prevent sexual violence. The approach could be social and emotional learning, teaching healthy, safe dating and intimate relationship skills to adolescents, promoting healthy sexuality, or empowerment-based training. A lot of times, students, youth, young adults mimic what they see. So if we're looking at a peer-to-peer model and everyone in your social circle or a few people in your social circle have relationships where people may not speak to one another with respect, people may manhandle one another, it becomes problematic if that is the norm for a relationship. So it is our job to teach these skills. What is healthy? How should men treat women? How should women treat men? Going forward, to normalize that behavior so that, again, by normalizing it, we will promote healthier relationships for our students and young people that we work with. Provide opportunities to empower and support girls and women. By strengthening economic supports for women and families, as well as strengthening leadership and opportunities, we really have data that suggests that women who are financially better off, as well as better educated, have less of these challenges. I'm not saying they don't have any of these challenges. I'm not saying that at all. But when opportunities are around for them, it boosts the self-esteem of these young women, and they're able to make better decisions and not be pulled into negative relationships. Creating protective environments by improving safety and monitoring in schools, as well as consistently applying workplace policies. That's essential to create a protective environment. As well, addressing community level risk through environmental approaches, also very helpful. And then support victims, survivors to lessen harm. Having those crisis centers and those hotlines available for victim-centered services, as well as treatment for victims of any sort of sexual violence, treatment for at-risk children and families to prevent problem behavior, including sex offending. So it's really on a number of levels that we can address this. issue of intimate partner violence. Next slide, please. So here is a prevention program at the individual level. College students are not equipped to deal with dating abuse. 57% say it is difficult to identify, and 58% say they don't know how to help someone who's experiencing it. So there are research-tested online, performance-based, and workshops and mixed method resources that have shown promise in increasing violence prevention skills through combinations of key program approaches, one of which is the bystander approach. Again, we talked about that a little earlier, normalizing what's happening in a community and making certain that everybody knows what an unhealthy relationship looks like so that they can speak up when they see it. Empathy, empathizing with the person who has been assaulted, dispelling rape myths. We all should know what rape is and what the definition of rape is. Alcohol use and how it can be used to encourage a number of sexual assaults and or sexual violence, as well as other unique approaches. Next slide, please. So the bystander intervention program engages both men and women as potential bystanders to situations involving sexual or intimate partner violence. It assumes that all members of the community have a role in shifting these social norms to prevent violence. It includes tools and ideas or action and strongly encourages each person to make a difference. So the onus is really on us and not the other person. When you see something, you say something, especially if we know that it's violating an individual in any way, shape, or form. Bystander intervention programs have become the most prolific prevention strategy to address campus sexual assault. Next slide, please. Empathy-based programs give participants the skills to understand sexual violence, provide a compassionate response to those who disclose, and reduce the likelihood of a sexual assault perpetuation by males. Some facts are women are more likely than men to experience physical limitations and overall performance and cognitive impairment as a result of intimate partner violence, which further elevates their risk for college interruption or permanent dropout. Higher rejection sensitivity, more fear of negative evaluation, low empathy, and low self-esteem are positively related to young men's domestic violence perpetration. Next slide, please. Dispelling rape myth programs. These programs address common misconceptions and myths about circumstances, causes, and realities of sexual violence. Topics often include rates of assault and reporting, which we know the data tells us plainly that sexual assault and violence far underreported. Definitions of consent. What is a full yes? What is a full no, especially if under the influence of alcohol? Clarifying common circumstances of assault. Some facts include much or most intimate partner violence among college and young adults in general is bidirectional. So we're not saying that all men are perpetrators, but there is a dynamic where women and men are engaging in some sort of violent behavior. Depression and other internalizing symptoms are usually more strongly and consistently positively related to intimate partner violence perpetration for young women than young men. Next slide, please. Alcohol education programs. These programs discuss the role alcohol plays in sexual violence and how drinking impacts the communication of consent. Facts. Increased access to alcohol on college campuses may double the increased risk of both female and male perpetrated intimate partner violence. Next slide, please. Other unique approaches include a combination of previous approaches to reach the greatest effectiveness. Still, others include even more creative spins where they're encompassing technology and social media and a number of digital platforms to get stories out. So there's a video game style design as well as survivor stories, humor and animation, hookup culture, interactive theater performance, student athletes, stalking, gender identity. So all of these things you can find on the cultureofrespect.org, and it will tell you exactly how you could apply something like that on your campus. Next slide. Other online program examples include Agent of Change, which is an online program in which players engage with animated characters and scenarios reflecting realistic situations in which students are confronted with opportunities to challenge the attitudes and behaviors that support and facilitate violence. Real Consent, which is funded by the Centers for Disease Control, is an online training program for sexual assault prevention that's aimed at educating college-age men. And then Think About It combines sexual assault and substance abuse prevention in an online training program using interactive activities, videos, and providing data and information to the participants. Next slide, please. Some performance-based program examples include Interact, which is a sexual assault prevention program that's interactive and skill building based on the pedagogy of Augusto Boal's Theater of the Oppressed. Scream Athletes, performed and facilitated by student athletes who discuss how attitudes, beliefs, and standards of athletic culture can support rape culture, the unique experience and pressures felt by student athletes, and the potential power athletes can have towards positive social change. Sex Signals incorporates scripted dialogue, audience-driven improvised scenes, and a focused presenter-led discussion designed to analyze and interrogate the components of a rape supportive culture. Next slide, please. Some examples of workshop and mixed method programs are Bringing in the Bystander, which teaches bystanders how to safely intervene in instances where sexual violence, relationship violence, or stalking may be occurring or where they may be at risk that will occur, where they may be a risk that will occur. About That Life is a bystander intervention workshop designed for students of color. The program's objective is to bring an anti-oppression perspective into sexual violence work. And Green Dot, which is another CDC-funded evaluation, aims to shift campus culture and increase proactive preventative behavior by targeting influential members from across the community with basic education, skill practice, and reactive interventions to high-risk situations. Next slide, please. So if you think you might be in a relationship with someone who is abusing you in any way, you can do a few things. You can reach out to someone you trust, a friend, a professor, an instructor, a parent, a club leader, or a coach, and perhaps your resident advisor, your RA. You can contact a local victim service provider, victim advocates group on campus, again, a resident assistant, campus health services, or even campus security to discuss what your community and campus can do to help you. And lastly, you can create a safety plan and think about discussing it with someone you trust or a local victim service provider. Next slide. Know your rights for orders of protection by contacting one of the Love is Respect helplines listed below. You can get an order of protection from family court if you are or have been in an intimate relationship with an abuser. You can call or text the online chat below, Love is Respect, and the 866 number for Love is Respect peer advocates. You can also text Love is to 22522. Next slide, please. Other referrals for support related to abuse include the National Domestic Violence Hotline. They're available 24/7, 365 days a year. There's an 800-799 SAFE number that you can call if you are in trouble or you have a friend who needs assistance. Next slide, please. So looking forward, college and universities have made fantastic strides. The totality of what collective institutions have done to address violence include multi-dose prevention for incoming students, conducting climate surveys and sharing the data widely, employing staff with diverse skill sets to provide trauma-informed response to survivors, and much more. However, there is still a lot left to be done. This work is an ongoing process. There is no one-size-fits-all answer, and we need to do a lot around comprehensive prevention, further developing our infrastructure, targeting audiences, partnerships and sustainability with others that may be interested in both the community aspect as well as the university aspect of intimate partner violence, as well as rigorous evaluation. It's really, really important for us to figure out what works. And again, since it's not one size fits all, it's more important to tailor each message to your target audience. So we're hoping that with you all on the line and some of these evidence-based programs, perhaps you can adapt it to fit your population, and through rigorous evaluation, you can become an evidence-based practice. That ends the webinar. I thank you for your time, and I'd be happy to take any of the questions that you have.
Remember, if you have any questions for Dr. Henry, you can type them into your text box.
So the first question I have is, why do schools manage intimate partner violence cases without local police intervention? I think for a couple of reasons. The first being that it depends on how it's reported. So initially, the student may report it to campus police or not, and that campus police is very centralized to your university. And upon doing so, it really is about that individual, the victim, the person who was victimized or assaulted, to bring it to the next step. They would never bring it outside of the campus unless it's extremely egregious. It always goes to the university first, and between the person who was assaulted and the university, they will decide if they want to escalate it. But it's almost always kept in-house because of the way it's reported, and very seldom does it get to the local police station, because you also have to consider what happens when that individual goes to the local police station, if she or he is as supported as they would be on a campus. So it really depends. That individual has the absolute right to go to the local police station if they're interested, but the school will not elevate it to that. They'll take care of it in-house with their online campus police system. Thank you for your question. The next question reads, how do you overcome social stigma for reaching out to get help? That is a really, really important question. I think that part of our evidence-based programming is around normalizing the discussion for citizens, just everyday people, to know what these acts of sexual violence happens to be. I think that it becomes very difficult for anybody to talk about their abuse when every single person around them is going to blame the victim. So part of it is we actually need to educate residents, community residents, persons on campus better, so that when you or your friends come forward, that we have that level of empathy and compassion to not question you, but believe you, and direct you to the appropriate resources. I think that the social stigma, overcoming social stigma, is really going to take a lot of work on the part of the residents, those who reside on campus, those who reside in the community, to really understand how difficult it is for someone who has been assaulted to come forward and what that all means, and really to be on the side of the person that was violated in some capacity. I really think that will help us to overcome stigma, and more people will come out when they know that they can trust the community that they're involved in and living in. Thank you. The next question reads, have any of the programs been implemented on HBCU campuses to date? There are a few. I can't tell you which ones. I believe it's the CDC, one of the CDC programs have been implemented on HBCU campus, a few HBCU campuses. Part of the challenge with that is with respect to how it's done, it's usually by a club or an organization on campus and not necessarily scaled up. And when I say scaled up, I mean coming from the leadership of the university, from the president's office or the chancellor's office of the university, and trickling down into the school. Those are two very, very different types of implementing programs. So I'm not sure about what has been done from a leadership standpoint onto the school. Every school has Title IX, but that's not the same as these evidence-based programs. And I'm not certain which HBCU has utilized the leadership from a top-down approach to make certain that the vast majority of campus knows this. I would have to look into that. Thank you. The next question reads, what are your suggestions for an emerging group of PPE students to promote messages about intimate partner violence, but also in a routine way and not just a singular event? I think that is an excellent question. It's very difficult to, one, get students' attention, but also to do things and promote things in a way that resonate with students in not just one event, like a Valentine's Day event or a spring break event. I think that in an effort to normalize any conversations about intimate partner violence, it's wonderful when it comes from leadership, but if it comes from a dedicated faculty member that can have maybe a chat and chew series every month for the semester, so that we start to talk about what is considered sexual assault and sexual violence. I think that there's a lot of gray in that area, which helps to, unfortunately, produce the social stigma surrounding intimate partner violence. So I think to normalize it, what we want to try and do is have regularly scheduled events and/or an office and/or a student-led peer-to-peer model where they run it and they can talk about some of the issues and/or concerns that their peers have. But again, this takes manpower and it takes a commitment from not only the faculty member but the students who are involved. I think that it can be done if people are committed to it, but I do think it will have to be done if we're serious about addressing intimate partner violence. Thank you for your question. The next question reads, what if you have someone that just will not get out of the situation, no matter how much help or assistance they were offered? That often happens because when you are in any sort of abusive relationship, we are talking about being at the lowest point of self-esteem and not really seeing yourself for who you really are anymore, because you've been trapped in something so unhealthy that it's hard to really understand what you would do when you get out. I think for the individual who has been offered help that chooses to stay, the only thing that I could suggest is that you just be there for that individual, because it's not going to end well. It's not going to end well. You can try, you have tried according to this question, but there's some things that unfortunately people have to learn on their own. And what we want to do as responsive citizens, as empathetic and compassionate individuals is we just want to be there when this individual hits rock bottom, because it will happen. Thank you. Can you speak a little bit about the gender differences regarding different types of intimate partner violence? So as it relates to gender, we know that even though rape and sexual assault generally are very underreported all across the board on campuses and just in the United States in general, we know that sexual violence occurs primarily against women by male perpetrators. So across the board, from young adulthood to adulthood, we see that occurring. We also see that with respect to the technological aspect of intimate partner violence. We see that more at the high school level. There are some indications that it's prominent, or rather prevalent, on college campuses, but definitely far more at high schools where we see the technology for both physical and psychosocial abuse. We see that more on the college campuses. We have it on high school campuses as well, but it's far more prevalent on college campuses by male to female. We have some cases, but they're not well captured for intimate partner violence where women are the perpetrators. We have more data actually for same-sex relationships where men perpetrate violence on their male partners, and that too would be both physical and sexual abuse, and less of the digital or social media platform abuse. Thank you. What suggestions would you give to engage both adolescent boys and college men to prevent violence against women and girls? Let me reread that. What suggestions would you give to engage both adolescent boys and college men to prevent violence against women and girls? Thank you for your question. I think that we definitely, across the board, should engage adolescent boys as young as possible, as well as college men, in what exactly rape is and how things that they have heard about, which are often misconstrued as a yes means a no, things like that, or rather a no means a yes. We need to start to educate them now that actually a no means no. And anytime you hear no, it's something you need to stop. There are evidence-based programs that work specifically with adolescent boys and young men, just so that they're aware. Some of these boys have sisters, aunts, and mothers, and I always ask, would you want this to happen to your loved one? Would you be okay if this happened to your loved one? What are some things that we can do? And we want to encourage them to inform their friends. So here it is, you have a young male friend in high school, or you two are both athletes in college, or just young men in college in general. They need to be very, very aware of what violence looks like on campus. And I think that one of the best ways to do it is obviously not having women teach them, but I think that having their same gender explain to them what the rules and regulations are around how you treat women in general. And I love using peer-to-peer models. I do believe that students are the best teachers to inform one another about the right and wrong way to do things. They speak to each other in the language that they're accustomed to speaking. And when you have student leaders that do that, it puts the onus on the student like it's not coming from an adult. And we can really help these young men to understand and teach one another about the ways to behave in a healthy relationship, but also what intimate partner violence looks like, the spectrum of intimate partner violence, so that they are less likely to engage in that behavior. Next question, please. All right. Okay. This question is a little long. So let me let me see if I can get down to the actual question. So this is an MPH student who's finishing her master's, and he or she works as a resident advisor in an on-campus apartment with many undergraduate students. This year, there's been many cases of intimate partner violence. However, this individual is limited to only passive education methods of outreach like bulletin boards, emails, etc., since the university holds programs for the students. Since I'm limited with my ability to intervene, do you have any suggestions on how I can get through to my residents? Are there better methods of passive education over others? There are some that I think that if you email me, we could talk offline about how to better do that, because I know that there are some people who are not privy to what those things are, but also because you're an RA, I'd like to talk with you directly about what we can do on your campus in that particular dorm to address some of these undergraduate needs, especially since there have been a number of incidents with respect to intimate partner violence. How can this issue be addressed since it starts in middle school? I think that, first of all, we need a comprehensive health education program. In middle school, when especially that age where puberty begins, there are a number of hormonal changes that young people are going through, and if these young people are not finding out about relationships in their household, it's really important that a resource like a teacher or a counselor, a middle school counselor, or even the school nurse begin to talk to students about what healthy relationships look like. The reality is we want to turn a blind eye to kids that are maybe 13 and 14 and say, oh, they're too young. But you know what? They may seem too young, but they are engaging in relationships and exploring relationships that at the age of 13 and 12, we want to make certain that these are healthy relationships. So I think it's really important for the school, the officials of the school, and hopefully the parents to start to engage them about how young women should treat young men and how young men should treat young women. At that point, we hope that a sexual conversation is not necessary just yet, provided your school does comprehensive sexuality education. But in the event it doesn't, we just want to talk about what healthy relationships look like. I think that is a fair assertion to come to a middle school with a display of what healthy relationships look like in a health class. Next question reads, how would a student go about making the case to a school to fund campaigns against intimate partner violence? In a couple of ways. My first question would be, do you have any data that suggests that intimate partner violence is prevalent? Do you know anybody who has experienced intimate partner violence? You could talk with your provost or a dean or a chair of a particular department and see if you can escalate it that way. I think that it's a very touchy subject, but you know what? Title IX is in every school, and your Title IX officials should have an answer for you in terms of making a case to fund this campaign against intimate partner violence. Title IX has money to do that. Now, what that campaign, it's probably not in the form of a campaign, it's probably more in the form of human capital, meaning manpower to address any issues after the fact. But if we're working in a preventative manner, what you'd want to do is meet with some of those folks who are funded by Title IX at your university or on your campus and ask them, you know, can show them some of these evidence-based programs. How can we roll this out for the incoming freshman class? How can we roll this out for everybody across the campus so they understand what this is? And I think that's one way of getting them to realize that you all are serious. Thank you for your question. Are there any additional resource materials available for different age groups that are culturally competent? I would suggest that you look at cdc.gov. They have a number of evidence-based interventions that are culturally competent for the particular population that you're looking for. And if you do not find any, I will happily look into that for you. And you could email me at thenry@minorityhealth.hhs.gov, and I will get those for you.
Thank you, Dr. Henry. So we are nearing the end of our time. I would like to say thank you to everyone who attended and listened to Dr. Henry's very knowledgeable webinar. I want to give out a few reminders. Please mark your calendars for our upcoming webinar on infant mortality with Dr. Michael Liu and Dr. Tamara Henry. And I would also like to remind you that the PowerPoint is in your window for immediate download, and that you will receive a recording of this webinar 24 hours after this session has ended. And lastly, Dr. Henry did give out an email address for you to submit any questions to. If not, you can also submit any unanswered questions to ppe@minorityhealth.hhs.gov. It's in your window, your chat window. And also there are a few other questions that are in our chat box. So what I will do is I will make sure those are sent to Dr. Henry as well. If not, I will let everyone go. Thank you again for attending our first webinar. Thank you, Dr. Henry.
You're welcome. Thank you.